Again. So this is a nice case of a patient who had saline implants placed in 1999. This is when you could only get saline implants because the silicone implants were banned. So this is her one and only set from 27 years ago. So as you will see, 100% total capsulectomy, 21226 initials WZ. And you will see I cut out a lot of this excess skin. This is the aesthetic contouring because the implants had indeed over the years moved downward and outward. So basically, this was the excess skin that I removed where the implant was working as a true tissue expander. Now, as you will see, look at the areas of calcification underneath. The entirety of the implant capsule has been removed completely, definitively, what is below the muscle. And now I'm going to go ahead and cut this open, and you will see, look how this secondary capsule has formed, and we're going to look at it. Very interesting how calcified this is. And as I remove this with my glove, you will see the implants truly breaking down. They're not lifetime devices. And if I go like this, you can see that stickiness. And this is your 325 saline implant, and again, very calcified, as you can see right here, hard. I'm going to go ahead and see if I can potentially remove this. The implant is very much intact, so I may potentially damage it, but let me go ahead and remove this. I'm going to tease this off. This is the secondary capsule that has formed. I want to send this off to pathology. That's the reason why I'm removing it. And you can see how the implant is literally breaking down. All right, very interesting. Seen this before many times, and so I'm going to send this off to pathology. Let me go ahead and go in here. This is the calcification. I'm going to flip this over. You can see the same breakdown product, 325. Leave that alone. Don't want it to. We have a good sample here. And you'll see the entirety of the implant capsule, all inflamed tissue has been removed. You can see some areas so thin. You can see my green glove. That's how thin the capsular tissue is. All of it has been removed. This is the inside of it. This is where the implant was sitting. This fatty tissue removed. All of the badness removed. And so, old implants. And there you have it. Now this is the I'm going to send this along with the capsule. I'm going to remove the top sterile glove. Now I have the left side, full thickness skin, as you can see right here, to help with the contouring, especially on the lateral. And the entirety of the implant capsule has been removed. It came with minimal blood loss. And as I go in, you will see relatively very thick tissue. As you can see, I'm having difficulty cutting it. Very interesting as to how the secondary capsule is forming around. And so if I go like this, look at this leaching of the silicone, and same pattern you see right here, 325. I'm going to take this off. We send it off to pathology as well. Secondary capsule. Look at this hard island of secondary capsule. I'm going to see if I can tease this off. Oh no, want to hurt the implant. And again, you want to see what the pathologist weighs in and says this is. Calcified. I'm going to tease this off here. I'm going to take this off as well, see hopefully it comes off. So you can see the implant is breaking down. You can see the rough kind of sandpaper consistency. It's slowly peeling off. I think that's a good sample here. So 325 again, implant breaking down. You can see the edges of it. And let's go ahead and see the inside, the entire capsular tissue, inflamed tissue. You see this fatty tissue, all of it being removed. This is the leaching of the silicone into the periphery. You can see how small, thin some areas are. You can see my glove. So overall, we'll see what the pathologist shows. See these abnormal red patterns right here. Look at this, all of this removed. So the implants will be returned to the patient, capsules to be sent to pathology, rule out the rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, and most importantly, we'll see how the patient does minus these toxins. This is Dr. Khan, Executive Plastic Surgery.